Welcome to our Menopause and You Chat with a Physician. I am Dr. Beverly Vaughn, Medical Coordinator of the Menopause and You program. Today we are fortunate to be speaking with Dr. Andrew Brown, a pulmonary medicine doctor and sleep specialist from Riddle Hospital. We will be talking today about how menopause can affect your sleep. Welcome, Dr. Brown, and thank you so much for joining us today.
Thank you, Beverly. It's a pleasure to be here today.
How much sleep does an individual really need on a nightly basis?
Unfortunately, Beverly, we don't have a blood test to tell us how much an individual needs to sleep to wake up feeling refreshed. So what we have done is to ask individuals who wake up feeling refreshed, how much did you sleep at night? And they usually indicate that they slept between 7 and 8 hours. So we assume that's the amount of sleep somebody would need to wake up feeling refreshed.
Sleep disturbance seems to be very common in menopausal and perimenopausal women. Is it primarily related to hot flashes, or are there other factors that are involved?
Clearly, patients who are menopausal or perimenopausal have hot flashes. Hot flashes have been shown to occur during the first portion of the night, and this does disturb these individuals' sleep. It can lead to insomnia. But there are other factors also that have a role. So for example, as women age, and even as men age, sleep becomes more fragmented. It's just a natural process. And what I tell women is if their sleep is fragmented, but they wake up feeling refreshed, it's not an issue. If they wake up feeling unrefreshed, then it is an issue. There are also other factors. As women age, they have chronic conditions that may interfere with their sleep. So women may have arthritis. They take medication that may be interfering with their sleep, that may fragment their sleep or lead to other sleep disturbances. So clearly there are a number of issues other than just hot flashes that will interfere with sleep.
Can you give me some examples of what can cause poor sleep?
One common example is consuming alcohol right before sleep. Alcohol is very good at inducing sleep, but it will lead to sleep fragmentation and individuals waking up early. Other factors include obstructive sleep apnea. This is a condition where individuals obstruct their airway because either their tongue or their soft palate fall back, and that will lead to fragmented sleep at night, and they may not even be aware that they're doing this, and that's associated with snoring. There are other conditions such as restless leg syndrome, which we often see associated with iron deficiency anemia, and iron deficiency anemia can be associated, especially in menopausal and perimenopausal women, with GI problems. So that's something they would need to look into.
Is there any connection between sleep disturbance and chronic illness?
Sleep deprivation from any cause can lead to chronic illness, and chronic illness can lead to sleep deprivation. So for example, individuals who have chronic pain syndromes from either osteoarthritis or rheumatoid arthritis can develop sleep fragmentation and chronic sleep deprivation. On the other hand, there are recent studies to suggest that chronic sleep deprivation from any cause leads to hormonal changes, and that this hormonal change can lead to weight gain. Weight gain, as we know, can lead to chronic illness such as type 2 diabetes and heart disease, and also can exacerbate or lead to hypertension.
What strategies would you tell a person to use to improve their sleep quality?
One is called stimulus control, and I encourage patients to remove from the bedroom any object that might cause anxiety. So for example, in individuals who clock watch, I would encourage them to remove the clock from the bedroom. In perimenopausal women who are having hot flashes, I would encourage them to turn down the heat in their room. In individuals who are having difficulty falling asleep, oftentimes actually cooling one's body will help induce sleep. So I might encourage individuals to take a warm bath or warm shower shortly before sleep. In addition, I would encourage individuals who are struggling to sleep to stick to a fairly rigid sleep schedule, and regardless of how sleepy they are in the morning, they should wake up the same time each morning, and in addition try to avoid naps during the day.
When would you recommend that someone have a sleep study evaluation?
Sleep studies are indicated for individuals who are not insomniacs, but who complain of excessive sleepiness. For individuals who can't stay awake during meetings, who arise in the morning and then need to take a nap several hours later. So these are individuals who might have obstructive sleep apnea or even narcolepsy, though we see narcolepsy in a younger population. On the other hand, most insomniacs do not require a polysomnogram. They're going to be up all night anyway, and so it's not going to give us much information. There's a subset of individuals with insomnia who might eventually require a sleep study, and these are actually in a minority of women who demonstrate insomnia from obstructive sleep apnea. There's one other subset of patients who don't sense that they're sleeping, and that if they come in for a sleep study and we actually show them that they slept, that'll improve their sleep quality just by assuring them that they slept.
Dr. Brown, thank you so much for being with us today. That was wonderful information that you shared with our audience.
It was my pleasure, Dr. Vaughn.